Hey guys, I'm Christiana. I'm a certified nursing assistant, a certified surgical technologist, and I also have my bachelor's of science in psychology. I'm right now at university to get my bachelor's of science in nursing. So let me tell you guys how I passed my fundamentals of nursing class my first semester of nursing school. So the very first thing I did that helped me really understand fundamentals was thinking safety first. When I was in that class, I was like, what is my priority thing here? 9 times out of 10, it's hand hygiene. Wash hands, wash hands. That's what a lot of times my professor tried to drill in our heads, that if you see it, pick hand hygiene. Of course, read the question firstly and make sure that it has to do with the topic that they're asking about. But that was a big thing, hand hygiene almost always, as well as lowering the bed, call lights, fall risks, all these things that are safety priorities for your patients. The second big thing that I did to help me with fundamentals was memorizing my ABCs. So this, of course, I feel like we all know means airway, breathing, and circulation. But breaking this down a little bit further can help you to know exactly what you need to pinpoint. So knowing that ABC stands for airway, breathing, and circulation is wonderful, but how can we apply that to more questions? This is where I, did practice questions where I could tackle topics like ABC and my ABCs and more so that I can know exactly what it was that was a priority intervention. My next thing that I did was that I tried to kind of get into the mindset of what is going to help this patient. So we all know ADPI or ADPI, as some people say, but a big thing is always starting off with an assessment. So they'll ask you a question and they'll be like, such and such is happening in the hospital, and what is it that you need to do first? What is your priority intervention? And for this, a lot of times, when you first start off nursing school, you want to answer with something like, I don't know, like question the patient, or something else that just like would be like kind of like an eye catcher of an answer. However, a lot of times the answer is assessing the patient. A lot of times the answer is asking open-ended questions. These are things that you kind of just pick up on as you go through the program. But however, those were things that I noticed tend to be the main topic of answering a question in fundamentals. And my last thing that I did were practice questions, tons and tons of practice questions. As I said in a previous video for my surgical tech exam that I passed last year, I was not a big fan of practice questions, but they really help you a lot. Good luck, guys.